My name is Laura Anderson. This video is a teaching plan created for the class Teaching and Learning for Health Professionals at Athabasca University. The teaching plan is related to a case study of Margaret, an 87-year-old woman with dementia who is freshly post-operative for a hip fracture related to a recent fall. Her family is available for teaching. The learning objective created for Margaret's family and chosen for this teaching plan is: by the conclusion of our teaching session, Margaret's family will be able to identify common environmental risk factors for falls in elderly patients with dementia, as evidenced by being able to identify risk factors and apply the knowledge to their home environment. The teaching strategies that will be used for Margaret's family are a brief lecture summarizing the pertinent material, a handout document from the Alzheimer's Society of Manitoba with the same information and more, written clearly for them to reference in the future, and a checklist from the Public Health Agency of Canada to help them identify common environmental risk factors and for them to use on their own at home. It's important to make sure the home environment is as safe as possible for Margaret's recovery to prevent future falls. The easiest place to start is to remove clutter. Keep surfaces level, dry, and non-slip. Clear away any loose wires and cords as well as any other obstacles, especially making sure that the frequently used pathways are clear, like between the bedroom and the bathroom. Keep furnishings in consistent places and in simple arrangements, and remove light, unstable, and low pieces of furniture that could be tripped over. Get rid of carpets or mats that aren't non-slip to prevent tripping on a rolled edge. Likewise, ensure door sills are no more than 1 inch high. Always wipe away any spills immediately to prevent slipping, and ensure that you have non-slip surfaces for the tub and shower. Installation of well-anchored grab bars by the toilet and bath are recommended. Good lighting throughout the entire house is very important, including the staircase and outside entrance. Outdoor motion sensor lights, night lights, and flashlights are recommended. Footwear is something important to consider. Avoid walking indoors in socks and slippers, as it increases your risk of falls. And ensure that footwear fits properly and has intact soles and a good tread that is weather appropriate. Sitting to put on footwear and using shoes with Velcro closures are recommended. Keep pathways and the driveway level, in good repair, free of clutter, and clear of ice and snow. And put garden tools away, such as hoses and rakes, when not using them. And the preferred location for the teaching session would be at Margaret's family home, so as to be able to evaluate appropriately that they understood the teaching and were able to immediately apply it under supervision. If unable to provide teaching in family care environment, then a spot the dangerous picture can be used to test if Margaret's family understand the concept. Physical copies of the checklist and handout will be given to Margaret's family to help as future reference of the teaching session. Thank you.